study I was looking at the other day. It's from about 10 years ago, but still pretty, it still has some relevance. And it was, they were looking at people, what are some things that we can look, what are some parameters we can look at with folks that are struggling with chronic low back pain that seem to be common in the folks that continue to suffer versus people that, excuse me, versus people that are not suffering from chronic low back pain? What are some differences and some areas that may have actionable recommendations, right? So if you're somebody with chronic low back pain and you have like narrowing disc space, or you have arthritic changes, age-related changes around the spine, or things like that, those aren't actionable. Like there's nothing you can do about it. But they were trying to decide, are there things that are actionable for the person that seem to be common in folks that suffer um, with chronic low back pain? And one of the things that they found that was pretty reliable across both people with low back pain, or some of those common across the people that had chronic low back pain, was a real lack of the ability to extend the hip. So, extending the hip means, when your leg is going behind you. So when that knee, I can't really see me that well, but like when we're extending the hip, this way, and that knee is going behind the hip, what they were finding in the chronic low back pain group is during testing of extension of the hip with a very common test in orthopedics, the the folks that had chronic low back pain, most of them didn't have any ability to extend the hip. They like wouldn't even go to 0 degrees, which is like neutral. They're and then the people that in the groups where they were not having chronic low back pain, those folks had um, those folks had hip extension. It wasn't even a lot, but they could extend the hip, 7 degrees or so or more. And the hip doesn't have tons of extension anyway. But what they, what they're kind of just finding in these groups is like, hey, for one reason or another, people that continue to suffer with lower back pain um, seem to not be able to extend their hips, or can't, or they have a real lack in that basic capability. And people that don't have chronic low back pain seem to be able to comfortably extend their hip. So, this could mean, it's hard to really correlate, these things, of course. It's not causative relationships; these are correlative relationships. There's noticing patterns when they look across the groups, and so, something that you could extrapolate is like, well, there's a possibility then, if we work with the chronic low back pain people to create meaningful levels of sustained hip extension, perhaps we can create a reduction in their day-to-day low back pain symptoms. So that would be kind of the intervention. And I would suggest any of you out there who are dealing with chronic low back pain issues, improving that, an actual step to take is the improvement of the ability for you to extend your hip. And so what this really means is like, people with low back pain that's chronic aren't putting themselves in positions or activities that require them to extend their hip, and so they end up losing that kind of basic range and that basic function that seems to be helpful when you want to avoid having chronic low back pain. So somewhere along the way, and you could probably tease this out even into behavioral changes in folks after they have their first bout of back pain. They may, through catastrophizing and fear avoiding behaviors, decided to remove those kinds of activities from their body that put them in positions where they need to have hip extension. And so then they lose, have reduced capabilities in that area over time. And then you see it, as you go to test it later, like, oh, these back pain people don't have as much hip extension. Well, it's likely because, not because lack of hip extension is causing back pain. It's likely because they're having back pain, and so they're reducing their exposure to those positions because they're afraid that those activities are going to hurt them. And then, over time, it kind of snowballs into a problem. So, just keep, something just to think about if you are somebody struggling with chronic low back pain, or if you're working with people that have back pain that it has become a little more chronic. That's a simple thing to look at. It's a simple thing to work on. Putting people into training regimens that demand their hip goes into extension, like lunging and rear foot elevated squats and things like that. So take a look at yourself, think about it with the people you work with, and take some of that information and hopefully make a difference in somebody's life who's dealing with back pain issues. So check out the rest of my channel for more stuff, and catch you next time.